Hi.
Hello, how are you?
So the other day I saw this really good preparation for hemorrhoids. I think it was called Preparation H. Do you have something like that in your pharmacy?
We do, but let me grab the pharmacist so we can talk to you a little more about it, okay?
Okay.
So how do I do a patient for you?
Hi.
Hi, my name is Mohammed. I'm the pharmacist here.
Hello. So, okay, the other day I saw this really good preparation for hemorrhoids. It's called Preparation H. Do you have something like that in your pharmacy?
We do have it in our pharmacy, but I just want to make sure we're doing this for the right reasons. So, is it okay if I ask you a couple questions?
Sure.
For privacy, let's go to my office.
That's great.
Okay, right?
That's great.
So let's get a better picture of this. Can you tell me? Could you describe to me what your experience been?
Oh, it's just general discomfort, feeling, down there in that area.
All right. So can you describe to me the discomfort? Is it like a burning sensation? Is it itchy? Is it?
Oh, it's a lot of itching, and yeah, just general discomfort. I guess a little burning and kind of painful, when you sit or you go to the bathroom.
Okay. Is it radiated to any other part of the body or?
No, just located down there in the IV go.
Do you know anything that might have caused it at all?
Oh, no.
Okay.
Not any single idea.
Alright, that's fine. Is there anything that makes it better or worse at all?
Well, going to the bathroom has been a challenge
lately,
and sitting is just not the same anymore.
So, alright. So, how long has it been going on for?
Oh, for a couple of days. I think it started on Tuesday. Since Tuesday.
So it's like it was Friday?
Yeah. So, a couple of days.
Okay, alright. Sounds good. Alright. So is this interfering with any other daily activities at all?
Oh yeah, it's hard to concentrate in life when all you're thinking about is that pain in your butthole.
Okay.
I'm sorry.
So still a little more questions. Is there any other symptoms that you're feeling at all aside from the itching?
No, just that.
Okay. All right. It seems like preparation is a good idea, but we're gonna go through a little more questions to make sure that's a good choice. That it is a good choice. So are you on any medications at all?
Nope. Good thing, right?
Yeah. Are you on any OTC products?
No.
Herbs, vitamins, or supplements?
No, not any.
Okay. And are you comfortable with using rectal medications at all?
I gave birth to 3 kids, so believe me, I can handle something as little as that going inside.
Right.
It's little, right?
Yeah, it is. We'll see. Speaking of children, are you currently pregnant or planning to get pregnant?
I'm done.
Okay, all right.
I'm done.
Well, considering what you've just told me, it seems like preparation age is a good idea. So I'll be back with the box and we'll pull it back.
All right.
All right. So this is the box.
Okay, it is.
All right. So this is hydrocortisone. This is preparation is hydrocortisone. Is the active ingredient? It's used for hemorrhoids or irritation. I'll just basically describe how to use it. So this medication can be used up to 4 times a day. It should be used once in the morning, once at night, and once at any time after any bowel movements. But you should limit it to 4 times a day. Applying it 4 times a day. So after you've gone to the bathroom, you should apply it. But first you should wash your hands before you apply it. Then, in order to use the actual medication, you should place the tube in the applicator. It's in the box, and squeeze the ointment into the applicator, and try to lubricate the applicator. It will help ease the discomfort a little bit, and then insert the tube with the applicator into the rectum about like ½ an inch, and then after you're done using it, thoroughly wash your hands and thoroughly wash the applicator and dry the applicator, and try to store the medication in a cool, dry place. Don't try to put it in the refrigerator, or try to keep it in your bathroom. And also wash your hands after you're done using everything, just so it doesn't get anywhere else. and try to avoid using the restroom for 1 to 3 hours. I know it's kind of a ridiculous stipulation, but it's just to help so that the cream actually works. All right. And just to make sure that you got everything, could you repeat back what I just said?
Alright, so I should use it only up to 4 times a day, no more than that, like in the morning, in the evening, and you said after like bowel movements, is that like tummy rumbles?
It's actually just after you've gone to the bathroom, like taking a poop. So.
Oh, alright, taking a poop. Okay.
Yeah.
Okay, so I should apply it, and I should not go to the bathroom after that for like 1 to 3 hours. Right. When I'm doing it, I should like apply the ointment inside, then kind of like lubricate it, so
right.
nice and easy.
Right.
And then don't apply it more than ½ an inch. Then wash my hands throughout after I'm done. Wash the applicator, dry it,
right.
Store everything in a cool, dry place.
Right.
And when will it, help this thing go away?
It's more to treat the symptoms, so it'll just help ease the discomfort that you're feeling. It's generally not used. You probably have to talk to your doctor if you want to. If there's more problems that occurs, but this is just to ease the discomfort.
Oh well. All right, then we'll see what happens next. Okay.
Do you have any other questions at all?
No.
Okay. If you have any other questions, just feel free to call the pharmacy. But just to make sure everything's going okay, come back in a week to follow up. You can see what's going on. All right.
All right. Thank you.
Thank you.